Hi guys, and welcome back. In today's video, we're going to talk about ways that you can treat the many causes of acid reflux and GERD. In the last video, we talked about the 8 most common causes of GERD that I see in my clinical practice. And now I'm going to give you the inside scoop on how you can treat this safely and effectively and naturally from your own home. Let's get started. So let's roll right into number 1, which is how do you increase the tone of the lower esophageal sphincter? Now, a lot of this is going to be more lifestyle modification and avoidance techniques. So for example, there are things like smoking and obesity and poor blood sugar regulation that can really damage the sphincter and decrease its tone. So treating the obesity, the blood sugar dysregulation or diabetes, and getting off of cigarettes or stopping smoking are really some of the most foundational things that you can do to improve the tone of the lower esophageal sphincter. One other thing that I see a lot of use in my SIBO and irritable bowel syndrome patients is peppermint. Peppermint, either gum or supplements or breath mints, can lower the tone of the sphincter. So if you are a gum fanatic or a peppermint fanatic, take that out of your system for a good month and see if your reflux doesn't improve. You might be lowering the tone of that sphincter without actually realizing it. Another thing that can be really useful, which I've talked about in some of my low stomach acid videos, is walking, either before or after a meal. I'll link it in the doobly-doo if I remember. There's a great study where they looked at people who walked for 15 or 20 minutes just religiously after dinner, and those people had better lower esophageal sphincter tone than people who did not walk after dinner. So even things like physical activity can really help with that. And that shouldn't be a surprise. We talked about it in the last video, how the vagus nerve and nervous system health really is going to be largely what dictates the tightness or the tone of that sphincter. And if there's any tissue in your body that loves exercise, it's the brain. So keep your brain and your nervous system healthy via exercise, quitting smoking, managing your blood sugar better, and your lower esophageal sphincter will probably thank you as a result of that. Now, getting into number 2, the poor mucus lining, that is actually a whole other ballgame. So whether you realize it or not, a lot of people have poor mucus lining health. In the last video, I talked about how people who have been on restricted diets, for example, the low FODMAP diet, are typically going to have very poor mucus lining health because your body just doesn't have the building blocks to make that mucus. So number 1, the most foundational thing you can do is if you have suspicions that your mucus lining sucks, point blank, get off of the restricted diet in whatever way possible. Now, I'll talk more about this at the end of the video. There are ways to do that, and I'll try to link that below too. I have a whole video on how to reintroduce the FODMAPs, and I have a whole course that is on that topic as well. But getting off of the restricted diet and eating a wide variety of plant foods is the best thing you could do for mucus lining health. Now, the other thing is this is where a lot of the therapies typically are aimed when you look at reflux treatments from the natural, nutraceutical world. And I've got a couple of my favorites here to show you. So first off, everybody probably knows about ginger by this point. You could get ginger as DGL in a chew, and this is where they take out the glycyrrhiza, the thing that gives people high blood pressure. But here's something to know. Yes, you can take DGL and it will probably work just fine if you're trying to coat and soothe the stomach and boost up your mucus lining, but you might not have to do that. You could probably just get plain old licorice, which is much cheaper and can be made into a tea or any sort of treat. You can get the chips or the powdered licorice root for much cheaper as long as you don't have pre-existing hypertension. If you already have blood pressure that's above 120/80, then I would probably go with the DGL form. But if you are like me and you have normal or even low blood pressure, go ahead and do the licorice. It's the worst case scenario. It's going to make you retain a little bit more water and artificially boost your blood pressure, which might actually get more blood to your cold hands and feet if you're like me. So licorice in either form can be really helpful for the mucus lining piece of the conversation. Now, the other 2 herbs that are frequently used for this is either slippery elm or marshmallow root. And you can see I've got all of these in my bulk herb dispensary here. But what I want to point out is a couple of things. Slippery elm is actually over-harvested. So if you could avoid this herb and only use it when you absolutely need to, I think that's the better way to go. You could get either of these as a powder or as a loose herb. Like you can see that this is just the shreds of the marshmallow root that I've got here. And what you could do for preparation is if you get the powdered herbs, you can mix it with a bit of cool water and then let it sit for about 10 or 15 minutes and form a gel. It's going to be kind of gross, but you can spoon down a spoon or 2 or 3 of this gel and eat it. And then that will be really helpful as far as coating and soothing the stomach and helping with the mucus lining integrity. You could also get it as the loose herb like I had for my marshmallow root. And you can just let that soak in cool water over the span of 24 hours or maybe a little bit more. And what it'll do is it'll make a cold infusion. It'll make a kind of cold, slimy consistency drink, and you can sip on that throughout the day. And I find that most of my patients prefer that to mixing the powders and having like a chunk of stuff to eat. It's kind of a weird texture when you do it that way. But I would do it that way. I wouldn't buy these in capsules necessarily. You need to give them time to hydrate and for those glycoproteins to really stretch out and tease apart so that they can do their job once they hit the stomach. If you're taking these herbs as capsules, I'm of the opinion that they won't work nearly as well. So keep in mind that you want to get the bulk herbs. You can get a lot of these on Amazon, or I really love Mountain Rose herbs. And you could do the same for licorice. You can get licorice root powder or licorice root cut and sifted chips for a very cheap price, and they're all very, very effective. Next up is everybody's favorite roommate they didn't know they had, H. pylori. So remember, in the last video we talked about not every H. pylori necessitates treatment. I do see this very frequently on a GI map where it's detected but it's not elevated and it's not virulent. This is the case for many, many people. But for some people who have the virulence factors or have a true overgrowth of H. pylori, then it really requires treatment. So keep that in mind as we talk about this. But for H. pylori, there are 2 ways that you could go about this, and it really will mirror a lot of the conversation we've had about SIBO and dysbiosis, which is you can go in there and nuke it, or you can go in and not trash your body in the process. You can gather which one I'm more in favor of. So in the medical world, the conventional medical world, they will talk about treating H. pylori with triple therapy, which is a PPI drug like Nexium or omeprazole, which is going to lower your stomach acid and lead to a whole other mess of problems, and 1, if not 2, antibiotics. That is outrageous, you guys. There are so many natural therapies that work for H. pylori. You don't need to drop an atomic bomb on this little critter. It's actually fairly easy to treat in my experience. Rather, what you could do is you could do a little bit of antimicrobials of the natural variety. So things like berberine actually work fairly well for this. And you could do things that will inhibit the growth that are anti-inflammatory. One of my all-time favorites is right now is sulforaphane, which is in a couple of products, but namely I use Jarrow Braco Max. It is an antioxidant, so it's going to work on the anti-inflammatory bit too. It's an antioxidant found in broccoli seed sprouts, and it is profoundly anti-inflammatory and favorable for the gut microbiome and modulating that as a whole. And it's also been shown to inhibit the growth of H. pylori, and it's very gentle. You're not going to nuke anything, and you're not going to give yourself SIBO from a damn PPI if you just take some sulforaphane, or even better, grow broccoli sprouts at home. They're very easy to grow and very cheap to do that way. So you could do things like broccoli seed sprouts. You could also do things like zinc carnosine, which will help heal the lining of the gut as well as all the other things we've talked about. And mastic gum. Mastic gum is very effective for this. I don't mind the taste. I recently tried it, actually. I thought it had a very bland, I don't know, we liken the smell to almost like dill pickles and incense. I know that doesn't sound appealing, but I found that it had a very tolerable taste, and it was a very, very weak taste, but the smell was very pungent. You could get plain old mastic gum as little nuggets on Amazon for very cheap, or you could get it ground up and put into a capsule, and that's probably what I would do more often than not. And then finally, there is a probiotic that's been shown to help lower and treat H. pylori in conjunction with other therapies, and that is the BioGaia Gastris. It is available in a baby drop probiotic and a chewable, and those 2 strains of lactobacilli that are in there have been shown to help inhibit H. pylori. So you can see you don't need to drop a bomb on H. pylori. Each of these things, mastic gum, BioGaia probiotics, and the sulforaphane, have research independently, and if you put the 3 of them together, it can go such a long way without damaging your body and your gut in the process. Now, we're going to get into the next one, which is stomach acid. And remember from the other video, I'm not talking about high stomach acid. Everybody knows how to neutralize an acid by this point. You take a little bit of bicarbonate, take an acid neutralizing drug, and bada bing, you're good. But you and I both know that high stomach acid is not the cause of 99.9% of acid reflux cases. Rather, low stomach acid can be a contributing factor. Now, as a reminder, if you have the autoimmune variant of this, if you have anti-parietal cell antibodies, then your focus is going to be quite a bit more on the microbiome and the inflammatory component in order to boost your production. But if not, you could also just take exogenous betaine HCl supplements and do things that help increase your stomach acid production. There's a whole other video that I did on that. I'll link it in the doobly-doo below also. But just boosting your stomach acid either naturally or exogenously can help correct the pH and get the system off to a good start as far as your digestive juices and triggering the reflux you need it to trigger. So low stomach acid is relatively easy to manage. Now, inflammation, on the other hand, does seem a bit ambiguous, doesn't it? I realize that that doesn't intrinsically help you. So we're going to try to parse this out a little bit more. Now, like I said in the last video, autoimmunity and inflammation often go together, but not everybody who has inflammation has autoimmunity. So keep that in mind. But when I talk about anti-inflammatories, there is a slew of them out there, and you can just do a Google and find them all. But things like green tea, boswellia, turmeric, resveratrol, ginger, sulforaphane, fish oil, melatonin. Like, there's so many things that are anti-inflammatory or antioxidant and can help regulate the inflammation. So if you are a person for whom you have a lot of autoimmunity or a lot of like joint and muscle pain or a lot of inflammatory symptoms, fibromyalgia, brain fog, and fatigue, you might consider really working on this piece of it. Because remember, inflammation and the brain and the nervous system do not get along. So if you are at all questioning the integrity of your lower esophageal sphincter and your vagus nerve, the inflammatory component of that does overlap strongly with that piece of it, as well as your ability to produce mucus, as well as your ability to produce stomach acid. So if you have a profound amount of inflammation, which you can try to measure on blood work or get an assessment based on your symptoms, then that might be something you really need to work on. And there's a slew of information on the internet about anti-inflammatory herbs and supplements and things that you could do for autoimmunity. Now, what is less talked about, and I touched on this in the first video, is hormones. And I'm actually not going to talk about the traditional allopathic way that hormones are managed, which oftentimes is the case with functional medicine as well, where they say, oh, you have hormone symptoms, let's measure the hormones. I'm going to instead talk momentarily about the people for whom you suspect you have hormone issues. An irregular period, a really heavy, awful period, lots of cramping, lots of symptoms and PMS around your period, lots of breast tenderness, or for men, difficulty getting an erection, low libido, brain fog, and just feeling blah all the time. If you have symptoms of hormone dysregulation, but your hormones look good on paper, I've got a little something for you to chew on, and it's both hopeful and not hopeful. You can have resistance to those hormones. So here's what I mean by this. Normally, let's see, I don't really have room to draw this now, do I? Normally, a hormone is produced in that it floats around in your bloodstream and it docks onto a receptor at a cell, and then that triggers a response. So either it docks onto the receptor and it's pulled into the cell, or it docks onto the receptor and then the receptor releases something. And all of these are trying to accomplish the same thing, which is changing DNA transcription, which ultimately changes the behavior of that individual cell. And if that receptor and that hormone are not doing their jobs efficiently, if it's not docking appropriately, or if it's docking and then the receptor doesn't do its job, or if it gets down to the level of gene transcription and it doesn't do its job there, then it doesn't matter if you have the perfect level of estrogen, the perfect level of thyroid hormone, the perfect level of insulin. If it's not getting into the cell and docking on the receptor and doing the thing it needs to do, it all means diddly. But here's the thing, this is really hard to differentiate because all that we really have as a tool in modern medicine is to measure the thing. But if that's not the end-all be-all, where does that leave the rest of us? Well, a couple of ways that we can work on this that are actually really impactful. A, inflammation. Just going back to the previous conversation that we had. If you have a lot of inflammation hanging around, no, your nervous system and your brain aren't going to like it, but guess what? Neither are any of the receptors or any of the tissues in your entire body. So making sure that your tissues are not inflamed so that the receptors and the mechanics and the DNA can work as efficiently as possible becomes a really big part of hormone regulation. And I'll tell you what, I have seen, particularly with women with PMS like breast tenderness and cramps, I've seen damn miracles from just high dose fish oil alone for like a month or two. because of that inflammatory cascade that can happen and interact with the hormones. And it had nothing to do with the amount of the hormone they produced. It had everything to do with how it was used. So working on the inflammatory component becomes important, but also pay attention to your environment and the toxins that are lurking in it. We just live in a toxic world, and we're bombarded by endocrine or hormone disrupting chemicals on a daily basis. And trying to reduce that exposure can be very beneficial. So you can fall down the Google rabbit hole on this. If you want a separate video, just let me know in the comments below. But endocrine disruptors include things like BPA or the other bisphenols, other compounds like phthalates that are found in plastics. If nothing else, stop microwaving plastic today. That alone will do miracles for your hormones. But things that are in plastics, things like parabens and phthalates and PCBs and formaldehyde, I could go on and on, but all of these toxins, all of these pollutants in our environment can mess with our hormones and their ability to do their job. And again, it has nothing to do typically with the amount of the hormone that's produced. So really clean up your toiletries. Go through all of your lotions and your shampoos and your makeup and your lipstick and your deodorants and start hauling out all of the things that have these toxic chemicals. And that can go a long, long way as far as the hormone regulation piece of this goes. Now, finally, let's get into the last two on this series, which is SIBO. Oh my gosh, you guys, I cannot do an executive summary of how to treat SIBO. It is just too big. That's what half of my entire video collection is dedicated to SIBO, if not more. So as far as treating SIBO, a couple of really quick bullet points to summarize hours worth of video creation for you guys. Yes, you may need to kill some of the overgrowth of bacteria or yeast or both. So antimicrobial herbs like oregano and berberine and neem can be helpful, but also resist the temptation to think that that is the only thing you need to do. You also need to treat from a holistic perspective, because guess what? If you have leaky gut or wacky hormones or inflammation or immune dysregulation, your SIBO is not going to go away. You need to focus on the things that your body normally employs to keep SIBO from happening. So think about the checks and balances like stomach acid, like nervous system integrity, like motility in the MMC. Start thinking through things like that and work your way through this in a holistic way. That is about all I can say in this short of a video format, but if you're interested in learning more about SIBO, I recommend you start with my SIBO mistakes videos and some of my SIBO basic videos, and I think that'll get you off to a good start. Now, for the hiatal hernia, this is something that could be either very mild or very severe. The severe hiatal hernias, where you have this pouching of some of the stomach up above the diaphragm and it's getting up into the thorax, if that's very severe, it needs surgery. There's no two ways about it. I'm not going to be the hippy dippy person on the internet who says, just take some licorice. No. If structurally your stomach is poking through your diaphragm and causing a great deal of distress, you may need to have surgery, and that's okay. It doesn't make you a lesser person or less of a hippy dippy person if you have a surgery. But now I can speak to the people who have a more mild presentation of a hiatal hernia, or they have suspicions, but they're not really sure if that's what they have. There's a few things that you could do that could be really helpful. First of all, you could either see a manual therapist or a massage therapist like me who's trained in visceral manipulation. And we can actually find the stomach, locate it, and start to pull it down. It does poke down through the bottom of the rib cage a bit to a point where you could usually feel it if you're trained in this technique, and we can start to pull down and get the stomach to come back into the abdominal cavity. Chiropractors sometimes are also versed in this, but if it was me, and I say this as a chiropractor, I would probably pick somebody who is specifically trained in visceral manipulation above a run-of-the-mill DC. And that's just my opinion. I think that it goes beyond what we're taught in chiropractic school, and visceral manipulation specialists are going to be even better suited for this. So you could have somebody work on that and try to physically pull the stomach back down into the abdomen where it belongs. The other thing you could do at home is really simple and easy. All you do is you're going to find like a chair or a table, something to balance on so that you don't fall over on me. Go ahead and drink a lot of water. Like I'm talking, 16 ounces of water. Gulp it all down. Fill your stomach with water so that it's heavy and weight it down. And then what you'll do is you'll get up on your toes and go down hard as you can without making it uncomfortable. Your goal is to slam down on the ground on your heels. And what that's going to do is that as your body comes down and your body abruptly stops, that weighted stomach that is now full of water should keep going for just a split second. And because of the weight that you just filled your stomach with, it can pull the stomach back into the abdomen just a little bit, just enough to get some of this to resolve and ease your symptoms. It doesn't work for everybody, but it does work for some people. Just a simple chug a whole bunch of water and slam down on your heels. Another thing that I actually like to do, because I have suspicions I may have a mild hiatal hernia, is rebounding. I got one of those miniature trampolines for my daughter like 2 years ago, and she loves it. And now I jump on it almost every day. And I just jump for a couple of minutes. Like, it's not a big deal. It's not a workout. But just rebounding for the sake of your lymphatics, which is a whole nother topic, and rebounding for the sake of jostling your stomach so it pulls it down just a little bit, I think can be really beneficial. And if you get a little trampoline and do this at home and drink a little water before you hop on the trampoline, all the better. I think that that is a great way to go about this, and hopefully you can avoid needing surgery for a long, long time. And finally, let's talk about one more thing that I just added to the list, which is histamine intolerance. I can't believe I almost left this out of this video. Oh my goodness. If you are histamine intolerant, and again, we talked about this in the first video, if you have more of a phlegmy, histaminic, allergenic profile to your symptoms, if you have a lot of eczema and asthma, hives, postnasal drip, things like that, then this is an avenue that you might need to work toward. And reducing the high histamine foods like tomatoes and strawberries and peppers and vinegar can really be helpful in your healing journey. But I want to mention here, because this is the treatment video, is that in my opinion, the low histamine diet does not need to be a forever thing. It's very similar to my feelings on the low FODMAP diet or SCD. You don't need to do these forever. They can be very useful band-aids in a time of need. But after you start to get your ducks in a row and you start pulling in things and treating things holistically and getting your nutrition and your life in line, then you can start to reintroduce some of those high histamine foods and build up your tolerance for them again. So just because you see histamine intolerance on this list, I don't want you to think that you can never have a strawberry again. That is very much not the case. You just have to reduce for a little while, like a couple of weeks or maybe months, and then you can start the journey of reintroducing some foods and trying to work on your immune system, work on your inflammation and your gut and your SIBO and whatever else you have going on, and reintroduce those foods slowly and methodically and safely. And it can be done. I help a lot of my patients with that on a day-to-day basis, so I know that it can be done. So executive summary time. If you're thinking, oh my God, what is all of this? Just take it step by step. You don't have to fall down the Google rabbit hole on all of these things today. That is not how it works. Just think through your health history, think through your lab results, think through your journey, and think what is the most likely, and then order them most likely to least likely and start whittling down the list. If you think, hey, all of that bit about the lower esophageal sphincter really sounded familiar to me, then start with that. If you're already on the low FODMAP diet or SCD or a restricted diet and you have GERD and you're thinking that that's relevant for the mucus conversation, then maybe you start with that. You don't have to take all of these supplements and do all of these things right away. Just start with the things that are most practical for you. And if that in and of itself is not helpful, if you're still feeling overwhelmed, there's two ways that I may be able to help you further. For one, I actually do appointments over the phone at Zoom with people who are not local to North Carolina. I only just started mentioning that in my videos. I don't know why I never did before, but we could do appointments together and I could help you and be your Sharpa on this healing journey. And I would love to do that for you. Or if you are more inclined, particularly if you are on a restricted diet, you might consider looking at my FODMAP Freedom in 90 Days program. It's an online course that I am so excited about because I'm going to help people treat all of this crap and more and get their gut squared away, get their ducks in a row so that they can tolerate the FODMAPs and the carbohydrates again and add these foods back into their lives and not only just enjoy their food, but have a damn mucus lining again. So if you are one of those people particularly, or if you have IBS or SIBO, I would encourage you to check out my course and join us on this beta launch because it's going to be honestly life-changing and I'm so excited to help people in it. I really hope to see you guys there. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.